Having optimal kidney function is critical for leading a healthy and vibrant life, but unfortunately, there's a lot of misinformation circulating about kidney health. This can cause people to avoid things that don't actually protect their kidneys or, even worse, ignore factors that are actively harming them. In this video, I want to discuss the 7 most common factors that can cause significant damage to your kidneys, as well as 5 prevalent misconceptions doctors often tell their patients, misconceptions that fail to protect kidney health. To truly understand the importance of kidney health, it's crucial to grasp the many vital functions kidneys perform. Of course, the primary role of the kidneys is to filter the blood, but their work extends far beyond that. They help regulate blood pressure, maintain electrolyte balance, and produce hormones that play a crucial role in red blood cell production. As a result, kidney dysfunction can lead to a cascade of health problems that affect nearly every system in your body. Maintaining optimal kidney health is not just important for your kidneys, it's essential for your overall well-being. Now, let's dive into the 7 major factors that can lead to kidney damage. By recognizing these risk factors, you can take proactive steps to protect your kidneys before permanent damage occurs. At the end of the video, I will also go over 5 common misconceptions that doctors often tell their patients, misconceptions that don't help protect kidney function and can sometimes be misleading. While I don't believe doctors intentionally mislead their patients, I believe there is a lack of understanding when it comes to kidney health, and it's crucial we educate both patients and medical professionals alike about what truly harms and protects kidney function. The number 1 cause of kidney damage is chronic high blood sugar, which is commonly associated with conditions like prediabetes, type 2 diabetes, and uncontrolled type 1 diabetes. Consistently high blood sugar puts immense stress on the kidneys, forcing them to work overtime to filter excess sugar and metabolic waste products. Over time, this constant strain on the kidneys damages the nephrons, tiny, vital filtration units in the kidneys that are responsible for cleaning the blood. When a sufficient number of nephrons are damaged, kidney function begins to decline, and the damage becomes irreversible. What makes high blood sugar especially dangerous is the fact that it also increases the risk of kidney disease through inflammation and scarring. This makes it even more difficult for the kidneys to carry out their normal functions. In fact, high blood sugar can accelerate the progression of kidney disease, leading to kidney failure if left uncontrolled. If you have diabetes or are at risk, it's critical to maintain normal blood sugar levels through healthy eating, regular physical activity, and medication as prescribed by your healthcare provider. The key to preventing kidney damage due to high blood sugar is consistent and effective management. Regular blood sugar monitoring, a balanced diet, weight management, and staying active all play a significant role in protecting the kidneys. If you're struggling to manage your blood sugar, it's essential to seek professional guidance to develop a comprehensive plan for control. Failing to manage high blood sugar not only increases your risk for kidney disease but also puts you at a higher risk for cardiovascular disease, nerve damage, and many other complications. If you have been diagnosed with chronic kidney disease, CKD, or if you're living with polycystic kidney disease, PKD, it's crucial to take proactive steps to protect and preserve your kidney function. Both of these conditions can lead to a decline in kidney health if not managed properly. The strategies I'll discuss in this video apply to anyone with CKD or PKD, so if you're facing either of these diagnoses, this information will be incredibly helpful in managing your condition and improving your quality of life. The number 1 step you can take to protect your kidneys is to get your blood sugar levels back to a normal, healthy range. High blood sugar is one of the leading causes of kidney damage, especially in those with diabetes, whether it's type 1 or type 2. Over time, consistently high blood sugar levels cause damage to the nephrons in your kidneys, leading to chronic kidney disease and potentially kidney failure. Even if you have PKD, high blood sugar exacerbates the condition by putting extra strain on your kidneys and worsening the symptoms. One of the most effective ways to manage and reduce high blood sugar levels is by adopting a very low-carbohydrate diet. This dietary approach helps stabilize your blood sugar and prevents those dangerous spikes that can occur after consuming high-carb foods. When you eat foods that are high in refined sugars and starches, your blood sugar can rise quickly, causing an overload of glucose that your kidneys need to filter. Over time, this constant blood sugar fluctuation damages the delicate filtering units in your kidneys, called nephrons, leading to scarring and a decrease in kidney function. For people with type 1 diabetes, it's even more critical to control your blood sugar levels through diet, as your body doesn't produce insulin to manage glucose. By adopting a low-carb approach, you can significantly reduce the frequency and intensity of blood sugar spikes, giving your kidneys much-needed relief and helping to prevent further damage. Even if you are on insulin or other medications, dietary changes are essential for optimal blood sugar control. A low-carb diet can also have other beneficial effects. By reducing carbohydrate intake, you can improve insulin sensitivity, which is especially important for kidney health. This can help your body better manage blood sugar and reduce the strain on both your pancreas and kidneys. Furthermore, a low-carb diet can aid in weight loss, which is beneficial for managing both CKD and PKD. Excess weight puts additional stress on the kidneys, so maintaining a healthy weight can help prevent further damage and improve overall kidney function. In addition to a low-carb diet, it's essential to monitor your blood sugar levels regularly and work with your healthcare provider to adjust your insulin or medications as needed. Keeping track of your blood sugar, maintaining a balanced diet, exercising regularly, and managing stress are all key elements in protecting your kidneys and slowing the progression of kidney disease. If you have CKD or PKD, the impact of uncontrolled blood sugar can be significant. By focusing on stabilizing your blood sugar through a low-carb diet, you are actively protecting your kidneys from further harm. This strategy can also help improve your overall health, prevent complications, and potentially reverse some of the damage that has already occurred. Taking control of your blood sugar is not just about preventing kidney disease, it's about improving your overall well-being. By making these dietary and lifestyle changes, you can live a longer, healthier life while preserving kidney function and minimizing the impact of chronic kidney conditions. The second factor on the list of things that can destroy your kidneys is chronically high insulin levels. If you're eating a high-carbohydrate diet and have been diagnosed with prediabetes or type 2 diabetes, you may be taking medications to lower your blood sugar. These medications often work by increasing your insulin levels, which can be problematic in the long run. There's significant research showing that chronically high insulin levels, also known as hyperinsulinemia, can contribute to kidney damage over time. When you eat a diet high in carbohydrates, your body produces more insulin to help process the sugar in your blood. Over time, consistently elevated insulin levels can cause damage to your kidneys, especially when coupled with high blood sugar. The key to preventing this problem is to lower your carbohydrate intake. By adopting a low-carb diet, you can reduce the amount of glucose in your bloodstream, which will help keep your insulin levels in check. When your blood sugar is stable and lower, your pancreas won't need to produce excess insulin, and if you're on insulin injections, your body won't need as much. In addition to protecting your kidneys, lowering your insulin levels has other health benefits. It can improve your insulin sensitivity, reduce inflammation, and even promote weight loss, which all contribute to better overall health. So, to protect your kidneys and improve your overall well-being, it's crucial to reduce your carb intake, manage your blood sugar levels, and avoid excessive insulin production. The third factor that can severely damage your kidneys is uncontrolled high blood pressure. Many people mistakenly believe that high blood pressure is mainly caused by too much salt in the diet or that it's simply genetic. However, the truth is that 80 to 90% of cases of essential hypertension, high blood pressure without a known secondary cause, are actually caused by chronic hyperinsulinemia, which leads to the body retaining an unhealthy amount of fluid. This condition is known as edema. When insulin levels are chronically elevated, the body retains more fluid than it should, increasing the volume of blood circulating through the blood vessels and raising blood pressure. The good news is that once you lower your carbohydrate intake and thus reduce your blood sugar and insulin levels, you can effectively eliminate the excess fluid from your body. This will help reduce edema, and as a result, your blood pressure will come back down to normal or close to normal levels. The fourth thing that can destroy kidney function is the long-term use of anti-inflammatory medications. This includes both over-the-counter medications like ibuprofen and naproxen, as well as prescription anti-inflammatories. While these drugs can be effective for managing short-term pain or inflammation like a sprained ankle or a sore back, taking them on a daily basis can be extremely hard on your kidneys. Over time, chronic use of these medications can cause kidney damage. It's important to understand that anti-inflammatories are meant to be used sparingly for acute injuries or conditions. Doctors often prescribe them for extended periods, sometimes without fully considering the impact they can have on kidney health. Using these drugs for days, months, or even years can gradually impair kidney function. If you're relying on anti-inflammatories regularly, it's a good idea to discuss alternative pain management strategies with your healthcare provider to protect your kidneys from long-term damage. The next factor that can significantly damage kidney function is the use of tobacco, whether smoking or chewing. Tobacco in any form introduces inflammatory molecules into the body that can wreak havoc on kidney function. If you currently use any form of tobacco, it's essential to gradually reduce your usage and ultimately quit. The harmful effects of tobacco on your kidneys can be long-lasting, and quitting is one of the best steps you can take to protect your kidney health. Another major contributor to kidney damage is excessive alcohol consumption. While an occasional drink, like a beer at a birthday party, may not pose a significant risk, drinking alcohol on a daily basis or in excessive amounts can be harmful. Chronic alcohol use places extra strain on the kidneys, leading to dehydration and the buildup of toxins in the body that the kidneys struggle to filter. If you are currently drinking alcohol regularly, I highly recommend cutting back. Aim to reserve alcohol for special occasions, rather than making it a daily habit. Reducing alcohol consumption will help alleviate some of the strain on your kidneys and improve your overall kidney health. The seventh factor that can seriously harm your kidney function is consuming a high oxalate diet. Oxalates are naturally occurring compounds found in many plant-based foods, and consuming them in large quantities can contribute to the formation of kidney stones. Certain vegetables are particularly high in oxalates, and if consumed without proper preparation, such as thorough cooking, they can cause acute oxalate reactions. While some foods contain lower levels of oxalates, even these can still pose a risk when eaten in excess. The most common type of kidney stone is the calcium oxalate stone. Many doctors focus on the calcium aspect of these stones, but it's equally important to reduce oxalate intake, especially for individuals who have experienced kidney stones in the past. If a kidney stone becomes large enough to block the ureter, it can create back pressure on the kidney. This back pressure is harmful because kidneys cannot function properly under those conditions. Prolonged back pressure can lead to permanent kidney damage. Therefore, lowering oxalate consumption can help reduce the risk of kidney stones and protect kidney function in the long term. Now, let's discuss 5 misconceptions that doctors often advise their patients to follow, believing they protect kidney function. In reality, there's either no evidence to support these claims, or substantial evidence that contradicts them. These misconceptions can mislead patients into making choices that don't benefit their kidney health. Let's dive into each one of them. First and foremost, there's a common belief that eating too much protein, especially animal protein, is bad for your kidneys. However, there's absolutely no scientific evidence to support this claim. In fact, numerous research studies have shown that people who have consumed healthy animal protein throughout their lives have not experienced any negative impact on kidney function. This is simply a myth, and some might even consider it a big fat lie. As long as you're consuming protein from natural animal sources like meat, fish, eggs, and dairy, your kidneys will not be harmed. It's only when people overconsume protein from processed protein shakes, which contain highly concentrated, pulverized protein, that there may be a risk of overloading the kidneys. But eating protein from whole animal sources is not harmful to kidney health. In fact, it's been the primary source of protein for humans for the past 2.5 million years. The second myth often propagated is that saturated fat is bad for your kidneys. Many doctors advise patients to cut down on saturated fat to protect kidney health, but there's no research to back this up. When your doctor tells you to limit saturated fat, politely ask them to provide the research study that proves this recommendation. You'll likely hear silence, as there is no evidence that supports this claim. In fact, eating a diet rich in healthy saturated fats from sources like coconut oil and animal fats is not harmful to kidney function. This is simply an opinion based on outdated beliefs, not grounded in scientific fact. The third misconception is the idea that ketogenic, keto, or carnivore diets are bad for your kidneys. A lot of this concern stems from the high levels of animal protein and saturated fat in these diets, but there is no scientific evidence that these diets harm kidney function. In fact, there's no controlled research to suggest that keto or carnivore diets are detrimental to kidney health. If a doctor tells you that a keto or carnivore diet will harm your kidneys, it's a red flag that they don't understand basic kidney physiology. These claims are often rooted in myths and fads, not science. It's time to reconsider that doctor if they're making such statements without evidence. Another common myth is that you need to limit caffeine consumption because it's bad for your kidneys. For decades, doctors have tried to prove that caffeine harms the body, yet there is no research that supports this claim. Drinking a reasonable amount of caffeine each day, 1, 2, or even 3 cups of coffee has not been shown to negatively impact kidney function. In fact, moderate caffeine consumption has not been linked to kidney damage. This is just another misconception that lacks scientific backing. And it's important to challenge it with the facts. Many nephrologists, internal medicine doctors, and family physicians frequently tell their patients is that you need to lower your salt intake to protect your kidneys. This claim doesn't hold up, both from a physiological perspective and based on research. Let's first look at it from an ancestral standpoint. For hundreds of thousands of years, humans have actively sought out sources of sodium in their diet, as it's essential for survival. This makes it clear that salt has always been a natural and necessary part of our diets. When we look at the research, there is literally no evidence that consuming an adequate amount of salt harms your kidneys in any way. By adequate, I mean salting your food to taste. If your taste buds tell you the food needs a little more salt, then that's perfectly fine. There's no reason to feel guilty or think you're doing something wrong when you add salt to your meals. This is exactly how mammals, including humans, have evolved to eat. It's natural. However, if you've already experienced some kidney damage due to factors like poor diet, smoking, alcohol use, or other insults, I encourage you to explore dietary options like the keto or carnivore diet. You can find 2 helpful playlists in the show notes below: Keto 101 and Carnivore 101, that provide comprehensive guidance. We've heard from hundreds, if not thousands, of people who had stages 1 through 4 of chronic kidney disease, CKD, and after following either a keto or carnivore diet for just 90 to 180 days, their kidney function actually improved. Many were amazed, and their doctors were stunned, unable to explain the improvement. Yet, some doctors still insisted that even though kidney function improved, they believed keto or carnivore would ultimately harm the kidneys in the long run. So, I implore you, avoid the 7 factors I mentioned earlier that can damage your kidneys, and don't fall for the 5 myths I discussed in this video. Take control of your kidney health and embrace the lifestyle changes that can help you protect and even improve kidney function. Here's to better kidney health and long-term well-being. I'll see you next time.